Have you been told by your clinician that you needed to focus on fitness, but you really weren't sure why that should be such a big priority for you? If that sounds like you, you've come to the right video. Hi, I'm Dr. Hampton. And as you know, I'm on a mission to help you achieve metabolic health. And today I'm with Coach Bronson, who is the author of the Ultimate Ketogenic Fitness book. And I think you need to get that in your hands because it talks about fitness and keto. I mean, who does that, right? So it's really nice. It's really nice to know that we have an expert who combined both. I think we all kind of do in the low carb space, but I don't know that we've actually gotten a book in our hands that does both. So I really appreciate him coming to this short video to talk about what are the five reasons, the five
Mhm.
reasons why you should focus on fitness in 2023. So, Coach, do some coaching today and tell us what you know.
Yeah, absolutely. Thanks for having me on. I appreciate this. I think the biggest reason why we should focus on fitness has to do with what our goals actually are. And a lot of people think that their goal is weight loss
Mm.
when their actual goal is improved quality of life. And weight loss really doesn't play that much as big of a role as a lot of people think it does in that. What plays a role is the physical ability that they have to do things. What plays a real role is how well their metabolism is working and all of those other factors, right? So I talked at a couple different places, and one of the things I equate it to is what good does an A1C of 5.0 do you if you can't get off the couch and play with your grandkids?
Mm.
Right? If you can't live your life, who cares what your blood work is? And we tend to look at those other things that are just numbers on a piece of paper that
Hmm.
don't really mean anything to what we can physically do. So that's why fitness is as important, if not in many cases more important than nutrition, is the way I look at it.
Wow.
Um, so there's five things specifically. All of them, in a way, have to do with one thing, and that is increased muscle mass. So we can solve a lot of problems in a lot of metabolic spaces with a lot of metabolic issues just by getting people to have more muscle, right? We know that muscle increases metabolic rate, it increases metabolic efficiency, increases hormone efficiency, increases immune system function. Like, it does all of these things just by adding muscle. You decrease injury risk, you decrease the stay you have to stay in a hospital if you get injured. If you have an illness, if you have an operation, you don't have to stay as long, your recovery is faster. Like, all of this stuff has to do with muscle. There's a lot of things that we talk about when we talk about exercise that really center around increasing lean mass. And that's probably the number one thing, right? If we can get you to grow muscle, and get this, I love talking about the ratio. We talk about body fat percentage all the time, and people like,
Hmm.
I need to lose fat. Well, what if, here's just a random thought. What if you could drop your body fat percentage without ever losing a single pound of fat?
That would be nice.
Right? Gain muscle and you automatically change that ratio,
That's
and
right.
things start moving in the right direction, and you haven't lost any fat. So the focus on fat loss is, I think, really misguided for a lot of people because it's really about increasing your physical capability, not just fat loss. So that's, I
That's
think, one
correct.
of the biggest
That's
things to
huge. I
realize.
love that. That's huge because again, it's why we do it in the first place. And
Yep,
um I got seniors, man, who just want to be able to get on the ground and play with their grandkids.
absolutely.
Yeah, so I
Absolutely.
hear you. Okay.
Right. I'm 50 years old. I got grandkids. I want to be able to be 60, 70, 80 and watch them grow and do stuff with them, and be 80 years old and still play in the
That's right.
backyard and do stuff,
That's
I
right.
mean, with their kids, with my great
That's right.
grandkids, you know what I mean?
That's
So
right.
yeah, it's fantastic. So that boils down to a couple of things. One, we want to be stronger. We need to be strength. We need to have strength. Strength is the number one determining factor for physical independence, particularly in the elderly. It's one of the reasons why I'm doing this. I watched my grandparents go down and just deteriorate and fall away. They had no strength, they had no physical capability. So strength is the number one thing. The second thing is metabolic efficiency. How well does your metabolism function? We know that you can lose weight and still increase your base metabolic rate if you're increasing your lean mass at the same time. So the idea of losing fat and building muscle, increasing how well your body actually works, is what we're talking about. And that is key. You have to have exercise in order to make that happen.
Hmm.
The other thing is, when we talk about insulin resistance, blood glucose, and all that other kind of stuff, we talk about glycogen storage. The more muscle you have, the better your body is going to manage fuel.
Hmm.
So if you want to drop that insulin, if you want to drop that glucose load on your body, give yourself more muscle fibers to hold some of that glycogen, and things will start to get better, as well as going through the process of building the muscle is going to help utilize more glycogen. So you're actually using more of the fuel. It's not just sitting there doing nothing. Number four, reduce your risk of injury, reduce the pain that you have every day when you get out of bed, right? How many people, raise your hands? I'm sure you've heard the older I get, the longer it takes me to get out of bed, right? I got to go through that
I
10
heard it
minute,
like twice today, and when I did virtual visits today, at least
right?
2 patients mentioned that. Yeah.
Yeah, you got to get up. It takes that 10 or 15-minute routine of working your back, moving your knees around, standing up and down, doing all that stuff to get your joints. If you build some muscle, it will take all that pressure off your joints. Muscles solve a lot of problems, and pain and aches and pains is one of the biggest ones that it solves. And then I think this is probably the biggest because it relates directly to quality of life. The minute you start doing something for your fitness, you automatically start improving your ability to live your life independently. That's it. The minute it doesn't, you don't have to do it for 6 months. You don't need a six pack. You don't need big muscles. If your challenge is going up and down the stairs every day, and you decide that my fitness goal is to be able to go up and down the stairs 10 times and not be out of breath when I do it, then you are immediately impacting your quality of life, because now you can do the stairs without help, without assistance, without getting tired. That's what this is all about.
Man, that's huge. I literally had a patient today who was a large lady, and because of her size, she was not moving around a lot. And I literally gave her a similar story. I said, "You're just in your 50s. How are you going to look in your 80s? I mean,
Yep.
if we make it that far." And so I just think it's so important as we listen, as we get a little coaching today from the coach, right? I want to make sure everybody walks away with these 5 lessons, because I think they're so critical. And I really think that these are the nuggets that you can kind of start your new year with and say, you know what, am I going to want to get the benefit that Coach just shared? So I just really want to thank you for coming to this video, but more importantly, you came to the Protecting Your Nest podcast, and we did some stuff on your YouTube channel. So we'll make sure to have a link to all of that information when this video is out. And but thank you again. And that episode was episode 134 of the Protecting Your Nest. Yes, we're doing it, man.
That's awesome.
This is a baby of the pandemic, and it's just every week, and you look back and you're like, wow, we're at 134. So it's really exciting. So for those who are checking out this episode, put in the comments what your favorite tip was, of those, or the benefits. What do you think about that? Maybe share your own so other people in this community can grow and learn as well. So thank you for coming to this video. Like, subscribe, hit the bell, and we'll see you in the next video. Take care.